The partnership is giving Kansas City police officers a breath of fresh air when it comes to handling and responding to a crisis.
The Now's Ray Daniel's been working on this story about how a local crisis center has now added a new tool to their police belt. Right, Ray?
That's right, Rhiannon, and that's exactly what officers were telling me just earlier this afternoon. It's a partnership between them and the crisis center KCPD. It provides a front door for those who are going through an emotional crisis.
Anywhere from 20 to 25% of all the police officers' calls for service deal with somebody in an emotional crisis situation.
And when these crisis intervention officers are on scene, finding a place for these individuals took time.
We've had no front door to take somebody in a mental health crisis situation. We've had a very fragmented services. It was difficult to break the jail cycle, street cycle.
But with a partnership at Kansas City Assessment and Triage Center, those in a mental crisis can get out of the criminal justice side and into the mental health side.
We're on the front line. I like to coin the phrase sidewalk psychiatrist. You know, we're the ones out there with the calls and stuff like that. And what the crisis center does, it allows us to take somebody to a central point and where they get into services.
The center opened just a year ago, open 24 hours, 365 days a year. You can see the impact in numbers.
Over this last year, we have had almost 2,800 referrals. 750 of those came from law enforcement.
Roughly 15 new patients come in a day and stay about 23 hours.
It's a short time period, but our whole goal during that time is really to assess what's going on, what do they need assistance with, and then we just work to get them hooked up with all of that.
It's a location hoping to break the jail cycle and give individuals the help they need while providing officers an added resource.
The whole goal is to relieve officers, be that no wrong door, get them back out answering calls.
Yeah, as of right now, the center only accepts referrals from KCPD as well as other area hospitals. I'm told if you do have a family member that's in crisis and you call 911, you can ask to speak to a CIT or a crisis intervention officer. In Kansas City, Ray Daniel for the Now KC.